Good afternoon, everyone. Thank you all so much for your patience and waiting for us as we work through a couple of technical difficulties here on our end. Technology is a beautiful thing when it works, and this afternoon it wanted to throw a bug at us. So we're going to go ahead and get started with our 2018 Healthcare Marketing Trends webcast. Joining us, the purpose of today is to go a little bit deeper on the 5 trends that we published earlier this year. We'll go a little bit deeper and tell you give you some more tips and tricks with your team this coming year. As we go through, you'll have the opportunity to ask us some questions. So in your GoToWebinar chat section, you'll be able to enter questions, and we can answer those for you towards the end of the webcast. And we are also recording today's webcast. We will share that link out with you afterwards so that you can share this with your team and have some internal discussions moving forward. So my name is Megan Walworth. I am the Director of Client Relations here at Franklin Street, and I am joined by several of my colleagues. I'm here today with Tim Roberts, who is our President and CEO.
Good afternoon.
Rachel McGuinn, who is our Senior Writer. Hello there. Tony Jordan, our Senior Art Director. Hello. And Brett Smith, who is our Digital Strategist.
Hello.
And the 5 of us here represent all of Franklin Street. We are happy to be here today talking on behalf of this whole group of folks. And those of you who are not familiar with Franklin Street, we are a healthcare branding consultancy. We are here in Richmond, Virginia. And we serve clients across the nation. And our clients do like a number of different things. Some of them are very traditional, large urban medical centers, and some are standalone community hospitals. We work with behavioral health organizations and addiction treatment facilities, and even some startup brand new organizations. So we are happy to have a wide breadth of clients and work with them on a number of different things. But the common thread for each of them is we are all working to create those patient-centered experiences in care. Specifically today, we'll talk about these 5 trends we believe will impact healthcare marketers this year. And when we are looking for trends to share with you, we try to keep 3 things in mind. The first is things that are not too narrow, and then things that are not too distant. So we want to find things that you're going to be able to pick up and leverage very quickly and rather efficiently. The 5 trends that we included in our report and that we'll walk through today are design thinking, culture wars, successful brands that make life easier, the decline of institutional trust, and the rise of artificial intelligence. And I think I said this at the beginning, but in case I didn't, if you've not yet had the opportunity to download the trends report and walk through that, you can find that on our website at franklinstreet.com. So we're going to start today with design thinking, and I'm going to hand it over to Tony to talk to us more about that.
Thank you, Megan. As Megan said, I'll be sharing the trend design thinking with you today. And this is one of those subjects that started in design and innovation-oriented industries, but have gained a lot of momentum in healthcare space now that the process is more systematic. You'll see a lot of talk and implementation of design thinking in the upcoming year and beyond. So what is design thinking? The short version is a new way for you to solve problems. It's human-centered creativity with a purpose. And why is it important? I went to the Stanford School website and been studying them for a little bit, and they use the concepts of durability, feasibility, and viability to help explain the value of this way of thinking. It takes the desirability from a human point of view and ask questions like, do they want this? With what is technologically feasible, asking, can we do this? And economically viable, asking, should we do this? And it overlaps them into one process. We sent out an email not too long ago, I think it came from Megan, that goes into more detail of why this is important. But in case you came to the webinar through this organic way, I just want to take a minute or two to share a bit more of the importance of design thinking. Some things that it does is it breaks down problems into bite-sized solutions. Design thinking helps you evolve quickly as the market evolves. It's scalable, so it doesn't matter how small or how large of a problem or how small or large of an organization you are, it'll work for you. And innovation is mandatory. One of our clients is OSF Healthcare in Illinois, and the VP of Innovation Partnerships, Matthew Warren, said it really well, so I'm going to give a little quote from him. He said, if healthcare organizations don't have an innovation agenda, they won't be able to compete, not just against the hospital across the street, but against future competitors like the Big Four, Google, Amazon, Apple, and Microsoft. I thought it was really important to distinguish that. Design thinking impacts your culture. So it builds consensus and understanding early on with leadership support. It builds teamwork with collaboration and fresh perspectives as you create multidisciplinary teams and teams that can work at the same time. And last but not least, it minimizes risk because you're using rapid prototyping, trying solutions out quickly, and they're not perfect, but it's iterative, so you can improve, then test, and try again and again. Okay, now for the good stuff. How is design thinking done? So first, you have to have a mindset, the buy-in, a culture of acceptance. You'll find some folks are naturally opposed to the quickness and imperfection of this kind of problem solving. It just goes against their nature. For those folks, it's best to tell them as much info as you can up front and give them design thinking references for them to study on their own. You can even link to our blog or this webinar, for instance, that could help them out. But then you'll also find there are folks in your team, like me, who really do thrive using this kind of process. So everyone needs to keep a few things in mind. So this is a very non-linear process. It's always moving and evolving, and you're always evaluating. You should have consistent check-ins, keep people on course, on track, and give feedback. And you should have multiple teams working on the same problem. If you have a big enough group, you can do that, divide them into smaller teams. So they're working on the same problems, but they're doing it in just different ways. Learn from failure and fail often. This doesn't mean that the process isn't working, but you'll take what you learn and build off of that. And so you'll learn more and more from failure than you would from success. And again, because you'll be doing quick prototypes and making them iterative, you'll be able to do that fail thing I just mentioned. So keep in mind that humans are the driver. This is rooted in empathy and understanding and then acting on others' needs, desires, fears, and hopes. Okay, so on your screen, you should see the process. And this is the empathize, define, ideate, prototype, and test. The first thing you'll do in this process is empathize. So this begins with the end user, a human. So if you want to go to the next slide, research, conduct focus groups, talk to people, ask lots of questions about their experiences. You don't have to have an end result in mind. In fact, don't presume, just let them talk and do lots of listening. We did that with a group of kids, our kids here at Franklin Street not too long ago. And this focus group, we're just talking about kids' experiences in healthcare. And you'll hear a little bit more about this in April when we launch some fun video of them. So it's a really fun thing to watch. And then when you're talking to folks, keep them asking why. So I'm not sure if you guys have heard of the 5 whys, but basically that idea is to continue asking a person why 5 times till you get to the root cause of their motivation. We also have a patient journey mapping process that we could share with you, and I think it may be in the trends report as well. and that helps with understanding the patient more. And then the next thing is define. So here's a Post-it, this is a wall of Post-its that this team, actually it's Home Depot team uses design thinking, and this is one of their shots. And basically, once you get all of this information from everyone's research and going out and talking to people, gather it in one place. A great way to do this is find a room with a wall, a big wall, and with Post-it notes, write down all your findings and put it in one place. Then start to bucket them. This is a quick and easy and inexpensive way of gathering information. So the next thing that you guys would do in design thinking, no, you can keep that one on, good, is ideate. Here you'll have to make some educated guesses. And this is what some call the ambiguity rule. And this makes people very, very uncomfortable, some people at least, where they don't really know the tight definition of things. Is you have to be uncomfortable with guessing and thinking bigger and wider, and throwing out all kinds of ideas. People also talk about the flare before focus. So you're keeping your ideas and mind open to all possibilities before you get too focused on just one idea to pursue. Get as many ideas down in one place on this wall or in a Google Doc, for instance. You could do that as well if some of your folks are remote. And it's likely that you're going to come back to them when the first point is to fail. Push it as far as you can and then come back to it. But then you'll have this nice big bucket of ideas that you started. The next one is prototype. So this image is of Women's Hospital, and I'll talk a little bit more about that with examples. But so when you're doing your prototype stage, this is really hands-on, it's quick, and it's iterative. So you will learn from failing, and you'll start again if necessary. You may not feel like you're making much progress, but however, you are, and you'll be better for it. Prototype is a very tactile process. Use paper, clay, markers. But what this does is it makes your work visible and gain support and understanding from others. We have some more details on rapid prototyping in the trends report if you guys want some more information on that. And then the final stage is testing it. So bring folks in to test your prototype, get feedback, be open to critique. So understand that the goal of that is to get better. And you should really critique all along the way. The testing stage is really when that happens in a big way. So you are in the testing stage implementing your ideas and your prototypes, and you're doing some more finalization of those. It may mean that you have a deadline. So and that may be the end of it. You got to get it done by a certain point in time. So if something fails, if it doesn't work, keep your mind. Always go back to that define stage mentioned earlier, where you can try another example and idea and bring it on through to implementation. So if you go back one slide, Des, so one of our clients in Delaware did the same as Boston, and they created a cardboard city. And what this was is to scale, laid out their new parts of their new hospital, with just using a very simple cardboard, placed outlets where they needed to be, created walls and doors and all of that, and invited nurses, physicians, local community leaders, and the public to come take a look and give feedback. And one of the things that they found out through this is some of the outlets seem so simple, but some of the outlets were just too low. So they raised them, adjusted them to give the nurses more access, and it was a little more easy for them to use their equipment. But what it really did deeper, on a deeper level, is it made the nurses community feel heard. They were part of this making, this understanding, and the excitement. It built a lot of excitement for the upcoming hospital. So in some ways, there's a little marketing in there as well. And the last one, because I know everyone else needs to talk too, this isn't just about design thinking, although I would love that to be true, is Capital One created, Capital One is a retail, go back one more if you don't mind. Yeah, this is actually a coffee shop, and they have a series of coffee shops that Capital One uses to talk to people. It is like an incubator. Capital One Labs is that whole department, and they come up with new ideas. And several years ago, they were doing some just basic research and found that a cloud-based app was like the future of banking, but they couldn't sell that to leadership. So what they did was, within these coffee shops, they spoke to people, they asked them their pain points and what got them excited and usability, and they all said, I want something mobile, I want to do banking on my phone, I want it easy. So they used that data and brought it back to leadership, and they were able to move forward with that cloud-based app. So there's some really exciting things you can do with design thinking, and I'll pass it on over to Megan.
Thank you so much for that. Thank you.
You're welcome.
So next up, we're going to go into a little bit deeper dive into culture wars, and I'm going to pass it over to Britt. Britt?
Great, thank you so much. So I want to remind everybody that this webinar is going to be available after we get off the phone, and that during that, if you're having trouble viewing our screen right now, you will be able to go back and see what we were talking about. That being said, my slides are really pretty basic, so if you can't see my screen, do not worry a bit. It's really more about what we have to talk through. So with that being said, the idea of culture wars, you think about that and you think about these big social movements, or you think about kind of this head-to-head combat in the midst of all of our day-to-day lives. In the middle of all of these social movements that are happening around us, every brand or organization can find an opening to take the competitive edge, regardless of what industry you're in, regardless of what vertical you're in. So if you might be thinking that the hashtag #MeToo movement, or that the gun violence movement that we're seeing right now, or really even retail movements like the evolution of Black Friday, you might think that they don't apply to you and your organization. And I'm willing to bet that this time you might be right, but that you also might be more affected than you really even know at this very moment. So at some point though, a social movement, a political movement, an organizational movement, it will affect you, and it will affect your people. That time, I'm willing to bet, is coming up sooner than any of us really think, and that includes those of us here at Franklin Street. So that's why it's really critical for you to break down those walls between your push and pull marketing, between who you say you are and who you truly are. Really, this isn't about crisis communications, it's about consistent communications. As your organization goes about its daily life, people on the outside interact with it. And that really means that as your employees are active on social media, or even maybe they're just wearing their work ID as they grab coffee, you as an organization are out there in the real world too. So for this reason, you have to acknowledge that these movements that are happening around us, they will have an effect on your organization. And it's really about how your employees represent your brand in the real world and what the intersection of all of those pieces really means. A really great example of this is, for all of you sports fans out there, it is the Major League Baseball team, the Cleveland Indians, as well as the NFL team, the Redskins. So for the Cleveland Indians, their logo is Chief Wahoo. And really, over the course of decades now, a group of people that was at one point a vocal minority, they've become so prominent in numbers and force and ferocity that the Cleveland Indians had no choice but to respond and listen and act. And what they've done is, as of this January, they have announced that they are moving away from the Chief Wahoo logo because of the external pressures that they were facing based on social movements and where we are in 2018. And the question that's put out there now is, the Redskins have been suffering under the same kind of pressure now for almost the same amount of time. So what are the Redskins going to do? Are they going to heed the lessons that the Cleveland Indians have had to learn the hard way? Or are they going to stay staunch and listen to really an increasingly minority population of people who want the Redskins name and logo to stay the same? Really, the big takeaway here is that even at the most granular level of your logo, cultural movements affect real-world organizations. This time, it was about a name and a logo, but next time, what is going to be the social movement that your organization has to acknowledge and reconcile itself with and deal with? So next up, we have a really positive story, actually. Don't worry, I'm not going to be doom and gloom anymore. REI is admittedly one of my favorite brands. I'm an avid hiker, and I love to just get out and go. You know, we're only 2 hours here away from the mountains, and I just love that. So one of the things that REI started doing several years ago is, rather than stay open for Black Friday, they chose to shut their doors. And I thought that that was so advantageous in terms of their brand, even if they were staring diminishing profits in the face. In their face. But really what it comes down to is that REI saw a disconnect between the values of their retail brand, those brick and mortar stores, and the passion of their organization as a co-op and as a team of employees who are really passionate about taking to the outdoors as well and spending their hard-earned money and their hard-earned time. So in order to encourage them to take to the trails, they closed on Black Friday. In return, they were absolutely lauded with praise. They saw increases in sales leading up to Black Friday as well as after. So one of the key takeaways here is that organizations who really follow their values and match it to their passion, they reap the benefits. So your organization must pair the values of its people to the values of its brand, to the presence that you have in market, and make that alignment actionable. It's really critical to getting a competitive edge over people who are either geographically located near you, or, as Tony mentioned, the world is changing. We have the big four breaking into healthcare pretty aggressively. So you are not going to be only competing against geographically based competitors, but also nationwide and universal competitors. Now, next up is Southwest, and I personally love Southwest as a brand. I think that, not for nothing, their tagline, "It takes heart," is just so iconic and so powerful to me. And the fact that they even went a step further and brought it into their logo in this latest iteration is just stellar. So Southwest, for those of you who are in areas where they fly, it's a very service-oriented airline, and their employees, honestly, if you interact with them, whether it is at a coffee shop while they're wearing their badge, or if it is in your actual experience at the airport, they can't help but smile on the job. They are so positive, and it feels genuine. But in the middle of their rebrand, what Southwest realized was that heart was the actual competitive edge that their organization offered. I can't think of an industry that is more downtrodden and more hard to deal with the employees. You know, we think about all of the rigmarole of going about travel, and everybody dreads the airport. But those Southwest employees, they really take that experience and they turn it on its head. So one of the biggest things here is that you have to embrace what makes your organization unique, even if it's out of bounds for your industry. And when Southwest made their key differentiator, heart, which is based on one of the truths that they live, their revenue soared. You know, they're breaking into new markets. They are moving their hub. It's just a really inspiring story. And then if we go down one more slide, so this is really, you know, one of the biggest things that we can talk about, which is if you want to make the idea of culture wars actionable, you have to understand the values of your people, your organization, and your brand. And you can do that with research and surveys and interviews and comprehensive analysis. Ideally, working with a third-party partner is really important here, because nobody can bring a clear and concise opinion of who you are based in fact than people outside of your organization. You get really honest and truthful and powerful responses when you partner with somebody outside of your organization to make these things happen. You also have to align your recruiting and your cultural efforts with the truth that your organization lives on a day-to-day basis. And then from there, you have to actually work with your marketing department and your HR department to make sure that you're recruiting the right people, that you are living the right culture, and that the brand that you are putting out there in market is in alignment with who you are at the most basic level of honesty. And then last but not least, you have to ensure that your marketing efforts really reflect your organization and culture. So when you're looking at these things, typically we tend to think of branding at the level of logo and campaign and an ad. So it's not just about thinking of whether or not those campaigns or those ads reflect the truth that we are living. It's about, do they ladder up to our core values as an organization and what we pride ourselves on as a unique differentiator. And that wraps up my trend.
Thank you so much, Brett. Thank you. And just before we turn it over to Rachel to talk about successful brands that make life easier, I am getting a few notes from a few of you that you're having a difficulty seeing the webinar. As Britt said, this is being recorded, pardon me, and we will send this out to everyone afterwards. So we'll be able to sync those two things up and make sure that you can see it. That said, if you can't see the screen, I worry that you're not able to send us some questions as we go along. So if you do have questions, feel free to email them to me. You can do that at Megan@franklinstreet.com. Megan is MEGAN @franklinstreet.com. All right, Rachel, we'll turn it over to you.
All right. So another trend already impacting our industry is how healthcare will redefine itself to make our lives easier. And guys, I don't know about your 2017 and your 2018, but mine have definitely not felt easy. So brands that give me that feeling are getting all of my trust. And when we think about the brands people are already starting to choose in healthcare, they all have this in common. They're engaging but simple to understand. And when we experience those brands, it typically does feel easy. And that's why we reward them with our trust. So two ways to look at how people base their decision on is the message they receive and the experience that they feel. And if you can see my screen right now, as a writer, especially if I'm trying to translate something complicated or technical to someone else, I like to channel someone I think does this brilliantly, which is Neil deGrasse Tyson. He has both nothing and everything to do with healthcare. His ability to break down the complexity of our universe and boil it down into simple, engaging, and actionable ways that everyone can understand, especially someone who doesn't study the cosmos for a living, is remarkable. And when we think of healthcare and how to distill information as complex as reform, health insurance, acuity care models, et cetera, to the general public, using language that isn't even in their daily vocabulary, it really isn't confusing why most people are confused about healthcare. We need to always remember to separate the essential from the non-essential in the message we're trying to reach people with, if we want them to understand and leave the complicated stuff of our industry to ourselves, the experts. So after someone does receive your message, your focus should be completely focused on their experience. This is where people are arguably going to evaluate you the most. For example, take me. If I'm someone in your community who's just received your brand's message, you've convinced me, I'm ready to make an appointment. How easy is it to make an appointment online? What about by phone? Is the person who answers my call friendly? Are they going to be able to help me directly, or will they transfer me to someone who I'll need to give my information to all over again? Let's say all of those things are perfect. Now it's the day of my appointment. Is parking fairly painless and accessible, or is it the opposite and will likely make me late for my appointment trying to circle the building? Make sure you know without a doubt the experience of both the people that interact with your brand every day and the people who work inside it. That will create the most efficient and easiest experiences for your consumers. Because for most people, if there are too many obstacles or snags in their experience that stand out to them, their choice will be easy to make, which is going elsewhere. And we can see how this trend is already going viral right now. For example, look at e-commerce on Instagram, or I gave another example in my blog post, shameless plug, about the grocery industry. Right here in Virginia, my grocery store is reinventing the way I shop by making groceries faster and easier for me to access. First, they developed something called ClickList, where a way for me to order groceries online, select a pickup time, and while I'm still sitting in my car, have the groceries brought out and delivered to me. Now, 2 other competitors, which are sadly outside of my delivery zone, are offering home delivery services for a nominal fee. And within our own industry, this trend is present in headlines about the recent CVS-Aetna merger, providers and insurers coming together under one roof to make people's lives easier. Even within the last week, I read a headline that 36% of Americans say they'd purchase a health insurance plan through Amazon, because I'm sure we would all agree that Amazon, more consistently than any other brand, makes our lives a little too easy. So I'll leave you with this. As you think about ways to apply this trend, here are 3 things you might consider. What are ways you can easily start within your own organization? Maybe it's a service line or a contained department to get your flow right. Or maybe you start where people using your brand every day would, how they make an appointment and how they interact with frontline staff. How can you easily spot barriers within your patient's experience in your organization? An example I gave in my blog was a friend's recent doctor's visit. After months of waiting for an opening, they arrived only to find out they no longer accept their insurance. So the barrier is figured out now. How will they solve it? What are ways you might be able to reduce or eliminate obstacles to make it easier for people to choose your brand? So this could look something like a fresh approach to your media buy, or conducting community focus groups to get feedback in real time, inviting people from the community in to have a voice. Or even something as simple as making sure people don't have to check in multiple times. I'll hand it back over to Megan.
Rachel, thank you so much. Thank you. Next up, we're going to hand it over to Tim to talk a little bit more about the decline of institutional trust. And Tim, I believe you're going to cover 2 trends for us this afternoon.
I am.
Trend 4 and Trend 5. So take it away.
Absolutely. The decline of institutional trust. That's kind of a heavy topic, a heavy quote there. But it's something that Franklin Street has been paying attention to for quite a while. And we've started to see a lot of other experts in the field also notice it, and you'll see it in reports and articles. And we want to make sure that the folks that we deal with in the health industry in particular is very aware of this macro trend, because it is going to affect you whether you know it or not. And if you're aware of it and you're working and understanding it, you actually have an opportunity, I think, to kind of take advantage of it in terms of the situation. It's so low that we almost think about this as a post-trust world, that we really need to move beyond this low level of trust throughout the country. It used to be that, for trust, you just simply said what you were going to do, and then you did it, not trust. But in a post-trust world, I think people are not quite as believing in terms of what you say, and instead they really want to see what you do first. So do it, say it, almost in that order. And in terms of where this is coming from, you don't have to think too hard to think about tons of examples, from Enron to Wells Fargo to Target, Volkswagen. Everyone remembers Volkswagen recently installed emission software on more than 500,000 diesel cars in the U.S. And roughly 10.5 million worldwide. This allowed them to defeat the EPA test and simply output more pollution than was allowed by law. And at the time, Volkswagen was using the term clean diesel. So again, a really breakdown in institutional trust from the organization. And I was thinking recently about, the state of our network news. I'm old enough, and perhaps some of you guys are as well, to remember a gentleman by the name of Walter Cronkite. he was not only the most trusted journalist in the industry, but Mr. Cronkite was the most trusted man in America, a news journalist, the most trusted person. A lot has changed since then. In fact, the most trusted television news source in America is British. It's the BBC. And more recently, we've seen, some really trusted companies let us down as well. Think about Facebook, a company that has, 2 billion monthly users. People, basically share their entire life on this particular platform. But just recently, Mark Zuckerberg was talking about the 2016 election and the fake stories that were being reported, the fake news that was being reported on Facebook. And he had said, no, that could never really happen or never really happen in great quantities. That was crazy. But nearly a year later, Facebook had to admit that they had sold over $100,000 worth of ads to Russian-controlled accounts, which ended up reaching 126 million people at the time of election. So again, just another large organization that we've had tremendous trust in, kind of letting the team down. Now, this isn't a phenomenon that's just in the corporate world. We see it in our world as well. Gallup, who does a long-standing tracking poll of institutional trust, when they asked, do you trust the medical system back in 1975, 80% of the people answered yes. Today, only about 37% say yes. So, half as many people trust the medical system as they did back in the 70s. Now, when you think about other things that we're doing in the healthcare industry, just look no further than the bills that we're sending to our customers. Very hard to explain, very hard to understand, with mysterious codes and sometimes the lack of clarity regarding the math in terms of how everything adds up. And then we have, our doctors. Now, most doctors obviously are very ethical and trustworthy, and I know I've worked with hundreds of them, either working alongside them with projects or just meeting them in interviews. But there are those few when terrible examples happen that really kind of shake the whole system. It was revealed not that long ago that a physician in, I believe it was in England, who was doing a liver transplant had actually, basically lasered his initials onto a person's liver. And, just a complete breakdown in trust, occurs when those things like that happen. We saw that with UVA quite a few years ago when they actually released the wrong baby to the wrong mother, and really just kind of showed that, things like this are really possible. And then, of course, most recently, the opioid epidemics. A lot of people are still kind of, pushing back and, are kind of, looking at that issue from a physician standpoint in terms of it just being way too easy to prescribe those painkillers and creating that epidemic. So we have a lot of, trust issues on our own plates that we need to deal with. But it's, like I said, it is a, kind of a sad thing in terms of when we see trust across the board sliding down, but it's not all doom and gloom. It's actually a huge opportunity when you think about it. Few industries can actually have their, business really built on trust. And healthcare is one of those industries that people are going to want to trust us. They need to trust us. And, our people literally have the lives of others in their hands. So in terms of thinking about trust and how we might be able to act on that issue, start with the idea of simplify, and this is very close to what Rachel had mentioned earlier in terms of make my life easier. Think about the language that we use on bills or just when we talk to patients. The idea of just speaking in normal, plain English and getting out of the industry jargon and really speaking to folks in their own language. People are ready for candor. Also focus on trusting experiences, like I'd mentioned, whether it's bills or paperwork, just the simplest things we can make simpler that will start to get people to kind of feel like you really get me. Second thing to take away is actions speak louder than words. Kind of like I mentioned earlier, people really want to see you do things, not just talk about the things. We had a trend, I believe it was last year, about the idea of, stories that inspire and actually, create your own story. So a great example of that might be, don't talk about how great your breast health program might be. Instead, take action. See if you can lead an initiative to get 1,000 women in your county to have their first mammogram. So again, that idea of creating your own story gives you that opportunity to actually take action. And then the other thing is just simply, close the trust gap. The companies, the health systems that are going to be really good at that is going to take a really big competitive advantage. You're going to be able to start to distinguish and separate yourself when you can be known as the most trusted, regardless of where you might be in this particular space. And so I'm going to keep going to the rise of artificial intelligence. I have to admit that my interest in this topic dates back to when I was a kid and when all the sci-fi and everything was coming up. It still fascinates me about where it can go, but AI isn't really science fiction anymore. It's already here, and instead of going too deep into this subject as far as, how AI actually works with its advanced algorithms, machine learning, deep learning, let's just talk about, kind of the big deal here in terms of how it can help you. And the big deal is really how it deals with big data. AI is uniquely qualified to help us deal with big data, and basically, it translates its learnings into insights that both you and it can act on. As it gets smarter, you get smarter, and your brand gets stronger. Remember, big data is really big, and it keeps getting bigger. So if we can take away some of that repetitive work, artificial intelligence can give you and your marketing team an opportunity to concentrate on more value-generating initiatives. And as far as what other people are saying about artificial intelligence and how that's going to make an impact, it was recently reported that 86% of marketers believe that AI will make their work more efficient and effective. And that was a quote out of Adweek just a couple of months ago. And Salesforce's research had showed that 60% of marketing leaders expect AI to improve campaign analytics, digital asset management, and insight collection. And then the chatbots and AIs believe that it's going to be saving $8 billion by 2020. That's only a couple years away, $8 billion. Currently, it's estimated that chatbots and AI are already saving $20 million a year. I want to talk about a platform that's out there called Albert, and this might be something that some of you might be familiar with or might soon will be. But Albert is really the world's first artificial intelligence marketing platform, specializing in media and optimization. And it's really built from the ground up using AI to be truly autonomous, and it requires little human manipulation, is able to accurately and seamlessly integrate media across all channels, paid and non-paid, including email, mobile, social, search, and display. Albert is really designed to really get the right message within the right context. And when we say the right person, we really are talking about AI being able to get down into that one-to-one type of marketing. Another big trend, I guess, coming out of the rising artificial intelligence trend is the idea of voice search. Now, this includes phone-based systems like Siri, as well as Alexa and Google Home. ComScore has predicted that by 2020, and again, we're only talking about a couple years from now, that 50% of all searches will be via voice. 50%. It's amazing to think about search and all of it being by, or half of it being by voice. It brings up a really interesting question about SEO. What are you going to do about SEO when it comes to a voice searching world? I've spoken to some experts around, actually internationally, about this subject, And they said for now, just really make sure you're doing, the right job as far as building your own normal SEO, following best practices. But remember that home search in particular, you may only get displayed if you're the #1 or definitely in the top page. The other big thing is to really pay attention to local. A higher percentage than normal of voice-activated searches are local searches. So just make sure you optimize your SEO for your own locality. Another big trend out of artificial intelligence that is rising is the idea of chatbots. Now, this is a fun little example of Mitsuka. She was considered one of the world's best, most human-like conversational chatbots. So conversational, really, when I started interacting with her, she wanted to be my BFF. But what's really interesting is what's behind Mitsuko, the company Pandora Bots. And Pandora Bots claims that they have 250,000 registered developers. Think about that, 250,000 registered developers working on their platform. And they've already created over 300,000 chatbots. So the sheer volume of chatbots that are getting developed on a regular basis is truly amazing. Another group to follow is Conversable. Now, they're going to be one of the most modern and well-used AI platforms, much broader than just from a marketing standpoint like Albert is. Conversable is enterprise-wide, and it's designed for building, distributing AI-enhanced messaging and voice experiences across basically all platforms, including Facebook Messenger, Twitter, SMS, Amazon Echo, Google Home, and many others. Now, they are basically focusing on Fortune 500 companies like 7-Eleven, Procter & Gamble, Budweiser, Viacom, Whole Foods. So they might be a little bit out of budget range for a lot of us here, but they are good to pay attention to because they're certainly one of the leaders in the market, and you'll start to get a sense of where the industry is going just by following those guys. And the last I want to talk about is IBM Watson. And if you guys haven't really paid attention to them, I strongly suggest that you do so. They have been working really well in both the marketing side with automation and predictive customer experiences, but also on the clinical side. Excuse me. And it's, in that clinical side to me where it's really exciting in terms of helping the healthcare systems actually just get better. There's examples of them in the cost savings world. For example, they've helped Orlando Health save $6.6 million in shared savings by working just 2 ACO contracts. They're very big in the world of population health and identifying and mitigating risk. They're basically anticipating where the clinical risk might be by using data to understand your community needs. So for example, Priva Health saw a 207% increase in office visits by diabetic patients who historically have been non-compliant. And Mercy Health just released that they saw a 5.7% higher ACO quality scores by partnering with IBM Watson. And of course, IBM Watson has been doing incredible things in the world of oncology and genomics, where they're really helping understand the data and basically identify truly personalized treatments for each patient. So with Watson, care teams around the world are implementing a more patient-centric cancer care model, as well as a patient-centered care model in general, and improving the experiences for providers and patients alike. And I think in the end, I think that we can, that's what we all want to see happen, a more patient-centered world. So, the key takeaways here: embrace AI. It's a complicated subject, but it is heavy, and there is a lot of things happening, and it's really going to happen quick. And the more you can understand it, the more you'll be able to take advantage of it. Start with voice search. It is coming, like I said, predicted within the next couple of years, maybe as much as half of voice searches online are going to be through voice. And then think beyond marketing. We all have marketing-related responsibilities, but ultimately what we're trying to do here is just make our organizations better and better for our patients, no matter how that's accomplished.
So just before we go into the Q&A part of today's webinar, A reminder that if this information is helpful to you, and it would be helpful to spend some time one-on-one going through one or some of these trends more deeply with you and your team, we are happy to do that. We do have a few slots still left available. So if you are interested, please email me at mwalworth@franklinstreet.com. Also, if you have questions and you're not able to submit them through the GoToWebinar link, you are welcome to email them to me now, and we'll answer them there. We do have a few questions that have come in already, so I'll go ahead and ask this. And I like this first one. It says, I know it's not one of your trends, but what do you think could happen with web accessibility standards in 2018? And I don't want to touch this one, but Brett, I think I'm gonna hand that one over to you. What do you think?
Oh, how kind of you.
Hey, that's how I am.
All right. So, when I think about accessibility and I think about what's coming in 2018, it's a pretty big, hairy question, and it's definitely a really big bucket. So what I do know right now is that the DOJ, the Department of Justice, has pushed off the public hearings about accessibility until I think it's August of this year. Just a quick reminder: the DOJ is the governing body because the internet was started as ARPANET for DARPA. So it started off as a military initiative, and we just reaped the benefits. Also, other countries have taken the lead on this, and even though I'm not really sure what's going to happen with the current administration and the state of deregulation, because this certainly would be regulation, what I can say is that there are international bodies out there that are really, really actively tackling this topic. The World Wide Web Consortium has what they call the Web Content Accessibility Guidelines, or WCAG, as I like to call it. And they have different rating levels. So my recommendation would be that in lieu of government action, take a look at the WCAG AA rating, and that will get you pretty solidly on the path to what will inevitably be kind of the government hammer coming down. But until we see that happen, I'm not sure exactly what form it's going to take.
Thank you. Thank you. We are pretty close to the top of the hour, so we are going to answer. We're going to take one more question here. Tim, I think this is going to come to you because it's all about AI. The question is, I've seen some chatbots, they seem quite clunky. Do you think they will really be able to take the place of people?
Take the place of people.
Yeah, are they going to be the ones who are delivering groceries to Rachel's car at the end of the day? They better.
Well, I think the short answer is in certain contexts, yes. I think we are going to be replaced by artificial intelligence in quite a few scenarios. To me, it's just a simple math kind of thing. The speed at which machine learning can take place and AI's ability to have literally millions of options top of mind is just going to make it a better customer service rep. It's going to make it a better kind of a guide. There's some things out in Las Vegas, when I forget the name of the hotel, but there's an artificial bot that you sign up to, and it basically kind of walks you around and talks to you about the odds of the games and where you can go for dinner and everything. Is actually at quite high level. I think we're seeing both low-end chatbots as well as high-end chatbots, and in a way that's a good thing because that means the technology is kind of being democratized with it. So it's definitely happened. It's going to be happening, I think, a lot sooner than people realize. And I think the telltale will be we eventually won't know if it's a bot or if it's a person that we're chatting with.
All right, I know that we're coming up on time, but we have one more question that's just come in. What is the logic behind someone outside of my team doing the research when it comes to our culture? Britt, do you want to take this since we were talking about culture wars just a moment ago?
Yeah. So, one of my passions is research, and I think that this really hits on something important, which is when you are trying to do research on your own organization, you're going to bring your own bias into it. And even if you are able to structure the perfect survey and the perfect interview and the perfect analysis of all of those findings, the challenge is that if you're the one on the other end of the conversation from the interviewee, they're not going to be honest with you. We know that it's human nature to be withholding and to not provide really accurate feedback, especially if you know the person that you're talking to. So it's really just more beneficial if you can partner with somebody who can help guide those conversations and who is actually really trained in moderation for interviews and focus groups. It just helps provide an additional level of, an additional guarantee of the trustworthiness of your research. And honestly, when you're touching something that's as big as your brand and your purpose and your organizational values, you really just don't want to mess that up. You want to hit the nail directly on the head, because the further off center you are when you start that process, it's just going to magnify when you go into market. And that's something that will ultimately affect your bottom line and affect your performance. So err on the side of caution, partner with somebody to do the research. If you need to take the execution back in-house, then that's certainly something to consider. But I would not recommend scrimping on the research portion and the value of a partner there.
Thank you.
Yeah, absolutely.
Thank you. So as we wrap up today's webinar, first, thank you all for joining us. Secondly, for those of you for whom the webinar did not function properly and was kind of being a bit temperamental, we apologize. We will send out the presentation and the recording to everyone, make that available to you in short order, but please accept our apologies when for those of you for whom it didn't work well. Also, keep in mind if having that one-on-one discussion about one or some of these trends would be helpful to you or your team, please just reach out and let us know. Thank you all again for joining us, and take care. We'll talk to you soon. Bye-bye.